Okay, so this one says exercise increases the risk of miscarriage, low birth weight, or early delivery.
Okay, thank you so much. Now, a pregnant woman is not a sick woman, okay? And so the pregnancy should not be a reason why the woman will say, I can't do anything, no. I can't stand up, oh. I can't walk, oh. And so she wants to be sitting down or be lying down and perhaps with all the house helps on earth, coordinating everything. It is strictly discouraged. However, I wish to say that the first 3 months of every pregnancy is quite critical because it's a period where it's as though the pregnancy is like a seed that has just been planted and has not taken root. And so any little wind or small erosion or whatever can sweep it away. So we discourage strenuous exertions, especially in the first 3 months, because those can lead to miscarriages. Okay, physical exertion. Okay, our practical example could be the woman trekking long distances, or she hops from one tricycle to the other, and while in the tricycle, the road is rocky. She's on a motorcycle, and all of that, or her job is so stressful, she walks from one place to the other. I want to discourage all those form of exertions because, especially in the first 3 months, is detrimental to the pregnancy. However, by and large, pregnancy is a period where a lot of adjustments occur in the body of the woman to accommodate the baby. And one of those adjustments could lead to production of some what we call clotting factors. Okay, they will be produced in a larger, in a more voluminous quantity like before, and that predisposes what we call to thrombosis, thromboembolism. Okay, and this thrives in an environment of stagnancy, or should I say dormancy.
Not doing
What
anything,
causes
just
blood flow, especially in the lower part of our body, is the movement of our muscles, our calf muscles,
muscles.
our hamstring muscles. Okay, so because of that, we are not saying a pregnant woman should be inactive. We encourage light, moderate exercises. Now, I'll state what that means. Okay, in our environment, just to say in our commonism, the average activity of an average wife in a house. I'm not talking about the one that has house helps everywhere. The one that is responsible, she does things, is even more than enough exercise for the pregnant woman. Okay. However, we talk about, as it pertains physiotherapy, brisk walks. Brisk, you are not strolling, you are not running. You are walking precisely. That is the kind of exercise we want to encourage. Okay, at least 15 to 30 minutes twice in a week. We are not saying you should take it hook, line, and sinker as a prescription, but we are just saying a pregnant woman should be active. We discourage high impact sports. Okay, deep diving. Some people swim. You go for underground diving. We discourage that. That could kill the baby. Yes, that could kill the baby. That's what it's called scuba diving. We discourage that. We discourage all these high impact sports, even sports that have to do with using rackets. She's exerting herself. We discourage it a lot because those impacts could actually cause abdominal trauma. Okay, that alone can cause, of course, depending on the impact, the placenta can detach. We call it abortion placenta. The baby can die. Even the woman's life could be at risk. Okay, it can, of course, give her so much pain. She can lose the baby. Of course, as I said, of course, preterm labor can even come out from there, and even preterm deliveries with its attendant complications of prematurity. Woman spends money, spends time, she's physically exerted with her family, taking care of a premature baby. So please, we encourage exercises, but these exercises should not be extreme. Light chores at home, you could do the dishes, could wash, but as your pregnancy advances, we discourage you bending down to want to wash. Some husbands are fond of allowing everything to the wives. Please, if a husband does that, it's pregnancy is a time where you give your wife some breathing space. Okay, she could even sweep using this synthetic broom and packer. She stands and does that. At least she just moves around and gets active. Okay, but we discourage strenuous high impact sports or strenuous exercises like jumping, running, skating, or and all of those very strenuous exercises that could cause trauma. Thank you.
That's right. So